Hi, my name is Danielle Kuhl, and this is my informative speech for Concordia University. The topic of my speech is Parkinson's disease and alternative treatment options. So imagine yourself nearing retirement age when all of a sudden you're having difficulty holding a pencil or holding a fork and you may even drop it. Imagine trying to write your name and your hand is so shaky that you can't complete the task. Also imagine having difficulty walking. You feel like you can't lift your feet up off the ground and you may even trip. 60,000 people per year are diagnosed with Parkinson's disease based on these symptoms. Out of those 60,000, 4% are 50 years or younger. My dad was diagnosed with Parkinson's disease in his early 50s. He exhibited the same symptoms and had them for about a year before he was referred to a neurologist. So what is Parkinson's disease? Parkinson's disease is a neurodegenerative disease, meaning that the neurological area of the body begins to degenerate and slowly change due to the decrease in the number of cells in the brain. The dopamine in the brain also begins to die as well. The neurons are responsible for transmitting the signals for movement throughout the body. So when there's a decrease in that or the cells begin to die, then the movement in the person's body begins to change. Typically, Parkinson's affects like 1 in 100 people over the age of 60. There have been some cases of people, though, who were diagnosed earlier than 60, including my dad. There are also treatment options out there, but they include medications. So I'm going to discuss some of the medications, how they work in the body, and then some either alternative or actually I want to say more adjuvant type treatments that go along with the medications. So what is Parkinson's disease symptoms? So some of the symptoms, they vary depending on the stage of the disease, and they range from anything from mild tremor to like an inability to walk, which is the final stage. Stage 1, the person may show like minimal signs such as tremor and a change in their posture or facial expressions. In stage 2, the person's posture becomes more noticeable, where they're having difficulty lifting up their feet, walking, and they might kind of hunch over a little bit. In stage 2, their tremors increase, and they also may begin to shuffle their feet when they walk. In stage 3, the person begins to have balance issues, and they're slower with tasks. During stage 3, they may even require someone to help them with dressing. In stage 4, the symptoms worsen and they may now need a walker in order to transfer and ambulate. In the final stage, the person is no longer able to walk or care for themselves. At this point, they're going to need a full-time caregiver, or they may have to be admitted into a facility where they can be cared for 24/7. In the final stage, they may even start to experience hallucinations and delusions. And then also during the final stage, they begin to lose the ability to swallow, to chew, to swallow, to drink, and they may not have that desire to do that any longer. So Parkinson's disease is diagnosed typically by a neurologist. The physician may examine them, and there is no real diagnostic test, but if they go to see their neurologist, the neurologist will take like a neurological history. They'll find out if they've had any issues neurologically in the past. They're also going to check them for change in their facial expressions or animation, because usually the person with Parkinson's will kind of have more of a mask type face, and they'll lack the expression that they did prior to being diagnosed. The neurologist will also look for tremor in the hands and the arms. They're going to examine their neck for stiffness or rigidity. And they're also going to check for shorter steps when they walk, because they'll start to have shorter steps and shuffle. So how is Parkinson's treated? Medications are their primary treatment for Parkinson's. There are several drug classes used, and depending on the stage of Parkinson's, age, and other diagnosis. The first class of medications, or the first type of medications, are the carbidopa-levodopas. They're the first choice for mostly the newly diagnosed patients, and can be used in advanced stage Parkinson's disease as well. A dopamine agonist is another group of medications that kind of trick the brain into thinking that it's receiving dopamine that it needs. Some of these medications, the names are Requip, there's Mirapex, and Nupro. They can be used with or without carbidopa, levodopa. The third type of medication is the MAO-B inhibitors. One of those medications, one of the names is Deprenyl, and Deprenyl blocks the enzymes in the brain that breaks down the levodopa in the brain, the natural levodopa. A fourth type of medication is the COMT inhibitors, and the name of that medication is Compton. And this works by slowing down the natural metabolism in the body's natural levodopa. Another medication that can be used are medications that deal with the symptoms of Parkinson's disease, and there's a whole list of those medications as well. Research has shown that Parkinson's symptoms can be slowed down by using the adjuvant treatments along with medication management. Some of these successful treatments are the Rocksteady program therapy, which has to do with boxing, bicycling, and a specialized therapy called the Big and Loud therapy. 60 Minutes with Leslie Stahl featured a story about her husband who has Parkinson's disease and all those others that were in the boxing gym with him who benefited from this program. So the Rocksteady program was founded in 2006 by former prosecutor Scott Newman, who has Parkinson's disease. Newman began boxing with this trainer, and after being diagnosed at 40 years old, he saw a huge improvement when he started the boxing. After receiving donations, he was able to hire some trainers and open up this program. And what he's discovered is that boxing helps patients with their strength, their agility, accuracy, and concentration, and hand-eye coordination. The next program or alternative treatment option or adjuvant treatment option is high cadence or fast pedaling, which has been shown to reduce the central motor control process and reduce tremors and rigidity. The TheraCycle is a specialized bike that's used in this program that has a fast force pedaling motion that's been shown to help Parkinson's disease patients with their symptoms. The difficulty with Parkinson's patients is that the patient's voice becomes very low and difficult to hear as well, and their movements become smaller. So the third treatment option would be called the Big and Loud therapy program. And it's used as a 1-month program that's taught by either a physical therapist or an occupational therapist. And what they do with this program is they have the patient work on their vocalization. They may even have a speech therapist come in and retrain the person to open up their mouth wider when they speak, to kind of slow down and think about what they're going to say and to really focus on the words. The other part of the program is that they're going to do everything more exaggerated. So when they walk, they're going to have them take longer strides. They're going to pick up their feet. When they move their arms, they're going to do it in a way that is more exaggerated, such as lifting their arms higher as they walk, or moving their arms more when they walk. So as we go along here, the disease, as I said, is a neurodegenerative disease that in time it becomes very debilitating due to the breakdown of the cells and the decrease in dopamine in the brain. It doesn't, like I said, does not have a specialized test, and as I discussed, the patient does have to be diagnosed with gathering history and watching for physical symptoms. So a lot of times they are put on medications that may not work, and it may take some time to kind of tweak that medication, come up with the right treatment for them, and even the right dose. Sadly, there's no cure, and the medications that help control the symptoms or change the chemistry in the brain, like I said, can be helpful. But the adjuvant treatments such as specialized boxing, the cycling, and the therapy have shown to decrease the symptoms and delay the progression of the disease. I just can only hope that my father and anyone else affected by this disease live to see a cure. Thank you.